Hello everyone. Welcome to NextYork, the channel where we debunk realities and tell you the true face of the Big Apple and much more. Today we are going to address a very controversial topic. Is it true that in the United States, if you are poor and uninsured, they leave you stranded? That in New York, people without insurance are not treated? There is a deep-rooted myth, even defended by some who claim that medical assistance is insufficient for the most vulnerable. In this video, we are going to expose the truth and show that far from being a paradise without coverage, in NYC there is a robust healthcare network that guarantees healthcare for all. First things first. In the United States, by law, no hospital can refuse you care in an emergency. This is because of EMTALA, the Emergency Medical Treatment and Labor Act, which requires any hospital with an emergency room to give you immediate medical care, regardless of whether you have insurance or the ability to pay. This means that if you have a heart attack, an accident, or any critical situation, the hospital must stabilize you and treat you right away. No one is left at the door. It's a legal obligation. They treat you first, and then figure out the money matters. So, if you've ever heard that in the United States, if you don't have money, they let you die. This is the first myth we're going to debunk. But the story doesn't end at the emergency room. Many people think that if you're poor in the United States, you don't have any health insurance. Nothing could be further from the truth. There are public programs that protect millions of citizens. Medicaid is the cornerstone of the healthcare system for people with low incomes. This program covers more than 70 million Americans, helping families, adults, the elderly, and people with disabilities. For example, Medicaid funds almost 40% of all births in the United States and cares for approximately 60% of the elderly in nursing homes. If your income falls below certain limits, you can enroll and receive comprehensive medical care, from doctor visits and hospital stays to medications and preventive services. Now, let's talk about how all of this works in New York City, a major center for healthcare in the United States. Here, world-class public and private hospitals exist side by side, ensuring top-notch medical care. Bellevue Hospital Center, one of the oldest and most well-known public hospitals in the United States, famous for its commitment to emergency care and for serving people of all economic backgrounds. NYC Health Plus Hospitals. This system, which includes centers like Coney Island Hospital and Elmhurst Hospital, is the backbone of public healthcare in New York City, offering urgent care services and preventive care programs for thousands of New Yorkers. On the other hand, we have internationally renowned hospitals like Mount Sinai Health System, known for its innovation and advancements in medical research. NYU Langone Health. With a modern infrastructure and cutting-edge technology, it offers fast and personalized care. New York Presbyterian Hospital, consistently ranked among the best hospitals in the country, it offers state-of-the-art care in multiple specialties. These centers not only serve patients with insurance, but thanks to state programs and grants, they also provide care to those who need it urgently. In addition, New York City has numerous community clinics and health centers in diverse neighborhoods, working hand-in-hand with public programs to ensure that everyone has access to quality medical services. Let's get to the comparison. Spain is famous for its universal healthcare system, where everyone receives free care at the point of service. But how does this compare to the United States system in key aspects? In Spain, waiting times can be long. The average for non-emergency surgeries is about 121 days, and around 20% of patients wait more than 6 months. In the United States, the wait for a scheduled surgery is usually only 28 days. This is due to a competitive infrastructure where, if you have insurance or access to public programs, the process is much faster.
I think that in New York, despite what people say, healthcare is expensive and not everyone can access good treatment. I've heard of cases where people wait for hours in the emergency room and the system fails to care for the most vulnerable. It's not about whether programs exist, but rather that, in practice, assistance is limited and they often leave people without the care they really need.
Thanks, Carlos, for sharing your perspective. It's true that there are criticisms and nobody's perfect, but let's look at the facts and real testimonials. As we've already explained, no one is turned away from the emergency room. The law requires that you be treated regardless of your ability to pay. Programs like Medicaid, CHIP, and the Essential Plan cover millions of New Yorkers, ensuring that even the uninsured have access to essential medical care. Top-notch hospitals in New York City, both public and private, demonstrate that the system works to offer high-quality assistance to all sectors, with cutting-edge technology and prompt attention. Ultimately, while some experiences may vary, the evidence shows that the myth of lack of assistance in New York doesn't hold up when you analyze the data and the actual healthcare infrastructure. It's important to acknowledge areas for improvement, but also to celebrate the system's strengths. You might be wondering, how can I apply for this free or low-cost health insurance if I need it? Here's how and where to do it in New York. First, visit the official website. To apply for Medicaid, the Essential Plan or CHIP, go to NY State of Health, the official health insurance marketplace for New York State. Next, fill out the online application. The site will guide you through a form where you'll need to enter personal information, details about your income, and your family situation. It's simple and available in multiple languages. If you prefer personalized help, you can go to an NYC Health Plus Hospitals location or a community clinic. There, trained staff will help you fill out the application and guide you through the process. You can also call the program's helpline and receive direct support to complete the process. Check the website for the updated number. Make sure you have documents like identification, proof of income, and residency handy. This will make the verification process easier. These steps will allow you to access health insurance that can cover doctor visits, hospital stays, and medications. It's a vital tool to protect your health and your family's health, regardless of your financial situation. Before we go, I want to leave you with a question to think about. Is it fairer to offer a healthcare system focused only on American citizens and even undocumented immigrants based on income and selective programs? Or is it better to choose universal healthcare like the one used in Spain? In the American model, access is prioritized through specific programs like Medicaid, CHIP, and the Essential Plan, designed to protect the most vulnerable. This system is based on eligibility criteria and, in many cases, on the ability to pay, which means that not everyone has the same ease of access, and that funding comes from both the private and public sectors. In contrast, the Spanish system is universal, guaranteeing that the entire population, regardless of their status or socio-economic level, has access to healthcare for free at the point of service. However, this model is financed through high taxes that affect all citizens, and sometimes there is debate about whether this tax burden is fair, especially in a context of growing social demands and needs. The question comes down to a dilemma of values. Universal solidarity. Do we prefer a system in which access to health is guaranteed for everyone, without distinction, at the cost of higher taxes and greater government intervention? Or is it fairer to opt for a model in which resources are concentrated for the most vulnerable through specific criteria, allowing greater freedom and choice in the private sector, but with the disadvantage that not everyone benefits equally? The answer is not simple, and depends on the priorities and values of each society. In the United States, there is constant debate about whether the approach based on market competition and segmented coverage is enough to guarantee social justice in health. Meanwhile, in Spain, the focus is on universality, even if it means taking on greater tax burdens to finance a service that everyone can use. I invite you to think about these aspects and leave your opinion in the comments. Which of these models do you consider more just and sustainable? We want to know your point of view. What do you think? Were you surprised by this information, the stories, and how easy it is to apply for insurance? Leave your comments below. If you liked this video, give it a thumbs up, subscribe to NextYork, and share so more people can discover the truth about our healthcare system. Thanks for watching, and we'll see you in the next video, where we'll continue exploring realities with a critical eye and an open mind. See you later. To recap, here are the key points that show that the myth of lack of assistance for those without insurance in the United States is completely false. No one is left without care in emergencies. The law guarantees immediate attention in critical situations, regardless of ability to pay. With Medicaid, CHIP, the Essential Plan and others, millions of low-income Americans receive comprehensive medical care. While in Spain you can wait months for surgeries or specialist consultations, in the United States the wait is significantly shorter, sometimes as little as 28 days for elective surgeries. The infrastructure in the United States, especially in New York, allows quick access to specialists and high-quality diagnostics, supported by cutting-edge technology. Survival statistics for serious illnesses and real-life cases show that care in the United States is effective and saves lives. Now you know where and how to apply for free health insurance. Visit the NY State of Health portal, go to a service center, or call the helpline. It's an accessible process for everyone. So, you know, the healthcare system in the United States, and especially in New York, isn't the healthcare hell that some people portray it to be. There is a robust assistance network that guarantees urgent care, effective public programs, and quality services. While there are areas for improvement, claiming that people without insurance are not treated in New York is a myth that, with data and real examples, is completely debunked.